I'm gonna pause. Hi, everyone, and thank you for joining us for today's webinar, Medical Wellness. If not us, then who? I'm Marianne Murphy, VP here at Medical Fitness Association. I'd like to take a brief moment to introduce today's presenter. Debbie Bellinger is a health and wellness consultant who specializes in health and wellness programming customized to particular populations. She has 23 plus years experience in 2 hospital systems in South and North Carolina, developing medical wellness programs and customized corporate wellness programs for local employers in the region. Within this work, Debbie has worked extensively with C-suite members, brokers, insurance groups, and large populations to improve health over time with programming that met clients where they were and attained measurable outcomes that demonstrated ROI. Today, Debbie offers advisory services to fitness clubs who want to get into medical wellness and wellness programming and employer wellness programs. She is also offering 2 CEC-approved master classes on breaking into corporate wellness and how to create and customize rockstar wellness programs. She also created a wellness academy to learn more about emerging trends in wellness and offers one-on-one coaching to help grow your fitness business. You can find her online at debbiebellinger.com. Now, if you have any questions as we move through today's webinar, just go ahead and type them in the question or chat section of your toolbar, and all questions will be answered at the end in the order they were received. All right, Debbie, take it away.
Thanks, Marianne. I am so thrilled to be here. Firstly, thank you to MFA for the opportunity to speak to this, and for all of those who are here with us today. Thank you for taking the time to participate and listen in and be a part of the MFA education series. So really excited to share this topic. As Marianne said, I've been in the industry a long time, and I can honestly say I believe my career shifted from fitness to wellness when I joined a hospital system. And that was in South Carolina, the first one. And up until that point, I was Group X instructor, coordinator, manager, director in operations, facility manager, doing all of those things, presenting. But when I joined my first hospital system as the first ever director of wellness, I was able to then learn about employee wellness programming because I was responsible for the health of our own workforce, which was 7,000 employees at the time, and programmatically offering fitness classes to the community. Working through my journey there, we added a medical wellness center. And when that happened, then I learned how to basically customize wellness programs, not only for employees. We had a strong Group X personal training program, but also to accommodate the patients from our healthcare system. And that was a huge growth curve for me, moving in my mind from a fitness expert to a wellness expert, learning how to programmatically bring together opportunity with my personal trainer team, my Group X team, and our docs in the system and our health professionals there to create customized programming for bariatrics, cancer, hip replacement, women's wellness, so forth and so on. And I only share that because I want you to have a little bit of the lens that I have, which is I see this conversation as population health. So it's not siloed, right? It's not what we're doing in a fitness center or a medical wellness center or in a boutique or out in the park. All together, we are responding to the health of the nation and the lack thereof, which is where we're headed. As a group, holding hands and creating opportunity for all ages, stages, shapes, sizes to be able to participate in their health journey with us leading the way. I don't think I need to share that the fitness industry still is leaning very heavily programmatically into the fit. And with the looming crisis of health in America, I think we need to look at all the opportunity to shine and leverage our skills to create opportunity to meet what it is the new consumer profile right now is what I'm calling it. So 3 years after the pandemic, the fallout is now just starting to present, and I expect it'll get worse before it gets better. In the interim, what our call to action is globally is to improve the health of the nation, doing what we know to do. And the need right now is those who are deconditioned, overweight, out of shape, afraid, all those kinds of things. So I see this health crisis and challenge in America from many lenses. So I see it from, how does this feel with burnout on the rise and mental health being the #1 health concern for employers? How does it feel for them and their operational budgets? How does it feel for individuals who are at home on the couch, gained 50 pounds, drinking excessively, to think that this is going to be the rest of their life post-pandemic because they're not going to a gym anytime soon? How does it feel to be a fitness club struggling to get members back in because they've gone to other places, right? So we all need to come together and leverage our strengths and fundamentally build bridges to a referral system that we can capture those who need us most. So in a way, I'm speaking to the 80%, but I think it might be more than that right now. So here's what I want to talk about today. And like Marianne said, type all the questions in. I love questions, and we'll take them at the end. I do love Simon Sinek too. And this particular quote that landed, I get one a day in my inbox, resonated particularly for this conversation today. So Simon Sinek says, creativity is the art of finding a new route to a known destination. So we clearly know where we're all headed, I believe, and what we need to do in the medical wellness field. We understand this. There's just not enough of us doing, right? So the message here is it's the time to be innovative, creative, basically solve problems, anticipate the problems, and meet new and or existing clients where they are. So let's talk about that. So what I would like to do today is dive into some health trends, what's happening, where are we currently, what are the headwinds in public health that we will be expected to attend to and make programs for, and then this huge gap in providers for lifestyle education. We'll talk a little bit about that. And then some strategies that I have used, that graduates of my master classes are using, and what I believe to be some really good opportunity for us as the medical wellness leaders leading the way in the fitness industry. So I feel it's an opportunity for us to teach commercial fitness clubs what it really could look like in partnership. There's just, in my mind, there is tons of opportunity. So what is it that is in the news right now? And this conversation shows where the money is going, right? So let's just dive in. So I'm sure you've all seen that there's a big conversation everywhere you look, LinkedIn, TikTok, Harvard Business Review, it's out there. So the weight loss drugs, the diabetes drugs that have been used for weight loss, being used for weight loss, excuse me, are creating a shortage for the diabetics who actually need these medicines. I had a speaker last Thursday, a Kaiser Permanente pharmacist in the outpatient space, speak to my Wellness Academy. And it was riveting, the data that she shared. And this is exactly some of what she shared, that their diabetics can't get the medicines they need because it has blown up on TikTok, particularly, where individuals think that they'll take this medicine, lose the weight quickly, and life will be great. But we know, as health and wellness professionals, that's not the long-term story, right? So just this week, in fact, GoodRx reported massive increase in the usage of Mounjaro, Wegovy, Trulicity, and Ozempic. My pharmacist who spoke last week shared that these drugs are not covered by insurance. And she said they can run out of pocket $750 to $935 per month. So for fun, I ran the math, and that's $11,000 a year to get some short-term weight loss drugs. And I'm not saying they're good or bad. I'm not saying that. What I'm looking at and wanting us to think about is how we, as health and wellness professionals, address this, right? So the long-term play, is it sustainable for an average individual? It's not recommended that you stay on these medicines long-term, but if a person wanted to have the conversation with you, let's say it's a personal training client, they think this is a long-term play and they want to be on this medicine year over year. This is where our ability to be educators and to connect the dots back to the healthcare system and speaking to the continuum of care, knowing where we don't color outside of the lines, right? $11,000 a month for weight loss medicines. Is that something that really is sustainable for the average American? That's a really nice membership at our facilities. Probably has some personal training in there too, right? So our value prop is we are health and wellness professionals. We are providing health education, lifestyle education, personal training, fitness classes, whatever your services are, for someone to have a beautiful life with health, sustained health over the lifespan, right? So although the medicine might be a great kickstart, and that could be a positive, just to have somebody lose a few pounds and feel like, oh, I can do this. Maybe I'll join the gym now or hire a trainer or whatever it is. If this short-term solution is a motivator to a longer-term solution, that piece might just be okay. So I think our job in what is going to happen here, my forecast for this is it will continue to blow up because of the investments that are being made in this area, and telehealth getting on board with it, teledoc specifically. What happens when these individuals realize they can't take this drug forever? And the pharmacist that I had last week said well over 2/3 gain all the weight back. Yes, they lose it, but they gain it all back and more. We've heard this story before, right? So what happens? Where are we in that solution? Should they take this as their kickstart? Where are we to meet them when the journey starts to fall apart on these meds? So our call to action is to have programs out of the gates where we're teaching healthy lifestyle choices, proper weight loss, these kinds of things, right? So the joy of programs, as we know, is that there's a start and a stop. There's accountability with a like-minded group. It creates community. It's not a one and done. So you're not leaving folks to their own devices to join a gym, hope they show up, hope they work out, hope they get health outcomes. That is not going to be the future of what it is that we're doing. It's a piece of it. But we need lifestyle education programs to bring people together, right? And it's a better ROI anyways when we get to the business of this conversation. Just recently, Yale Medicine reported that the mental health issues are rising in the younger adults. So in 2019, 11% of younger adults reported mental health issues. 2023, we're up to 41.1%. So no matter the stage of life we're talking about, mental health is of major concern in America. Suicides are on the rise for physicians, dentists, and young teens. We all know exercise is medicine. It is a drug. If we could just get people moving a little bit, maybe this statistic could be altered, right? We could bend the curve here a little bit. But we have to be wise programmatically to make sure that we're offering opportunity where we meet the consumer where they are. So that might mean 15-minute sessions instead of 30, 45, or 60 minutes of something, right? And then adults also reporting 40% reporting mental health issues. This one, I think, is going to get worse before it gets better with all the negativity and the true crises that are going on in the world. if you turn your TV on, it is very depressing, right? So Arrive Health, an interesting article I read basically said we're experiencing an epidemic within the pandemic. So we know prior to the pandemic, there was a huge push to address the national opioid crisis. So when I was in the hospital system in North Carolina, we were doing a lot of work on this, and we were making gains, getting things in place for those in need. And unfortunately, the pandemic has basically fueled this national opioid crisis and is on the rise again. So that is also something that we need to be aware of. And it's sad for some, the pandemic has literally tested all coping skills. And that doesn't, when you're sick and tired, that's really hard to find the motivation to make behavior change, to choose the right foods, to get the sleep. And sometimes some folks lean into other choices that are not the healthy choices. We also looking at, because of my background, I'm looking at the employer data as well and how corporate America at work is being impacted. One of the good things of the pandemic has been more conversation around the importance of health, the importance of well-being, and in corporate America particularly, understanding that well-being at work is key for employee satisfaction, employee engagement, employee retention, and recruitment. So what I'm seeing right now in the industry is some companies looking at the empty offices and refurbishing spaces to put a mini gym in and or to reboot the existing space that maybe has not been utilized for the last 3 years as an incentive to invite employees back into the office. So having an on-site facility for well-being at work as an option is a strategy. So one of the good things of the pandemic is that more employers are realizing the impact and importance of having employee wellness at work and baking it into the benefits that they offer. So this is huge. And 64% of employers committing funds, you have to take that step, otherwise it's just talk, to be able to offer employee well-being at work or hybrid opportunity, and looking for vendors with the experience that we have to partner, because HR directors are not going to be able to lead well-being sessions, fit breaks, that kind of thing. So also in the news right now, employee benefit news, this was from March, that health and wellness is the top benefit that employers are using to recruit new employees and to retain existing. Here's an example of what's going into a job description now. Job postings mentioning free therapy, counseling. The larger companies typically have EAP, but ramping that up. Gym memberships, and that had gone away for a little bit, and subsidies for memberships are seeing a major spike. So using the health and wellness industry and what it is that we do as a perk to recruit new employees. So your call to action is the low-hanging fruit in this to have impact and reach more people is to make friends with your local employers. Let them know what it is you do. Let them know the programs you have for chronic diseases, for stress management, for general health and wellness, for fitness, for fit breaks at work, whatever it is that you are prepared to take and do, let them know that this is what you can help them with. I don't know, having worked in employer wellness for 23 years, that employers necessarily know, this was not my experience, who to approach to have on-site workplace well-being. And I'll say to you, they probably don't think they're going to go to their local gym as the conversation starter. Besides, it's on us to start the conversation because we're the experts. All right, so let's dive into the data to just talk about what does it really look like and what is it and where are we needed. So in mental health, this is the #1 health concern in America as deemed by the Surgeon General from fall of 22. If you have not yet read his framework for mental health and well-being at work, please have a look at it. It has 6 practices, and one is do no harm. That's the same practice that we have in our medical wellness centers, right? Same for the medical industry. So I would make friends with that, because if you'd like to approach employers, the value prop for you as a medical wellness center is that you can meet those 6 framework items that are noted by the Surgeon General, that your programs qualify in all 6 areas. So you're a good partner, because we need to be in the evidence-based space, right? So we have 1 in 5 Americans that is burned out, and 76% reporting mental health issues. This is from the American Psychological Association. The cost of this and why we're needed is employee burnout costs $322 billion in lost productivity. And it was suggested that there would be an increase of 13.8% in employer health spend in 2013. That was from Deloitte Touche. And we know this is not sustainable. Year over year increases like that, invariably what's happening now is the cost is being shifted to the employees. And the downstream impact of that is employees are not electing insurance. And if they do, many are not affording the copay, so they're just not going to the doctor. All of that is a perfect storm of more health issues in America. So if we've got individuals that are not going to their annual well visit and getting ahead of things before they become a full-blown crisis, that's not a model we want to lean into, right? Now we know this, but our job is to educate the employers. And so we end up having conversation about cost avoidance first. If you don't get your employees healthier, here's the potential cost, an increase in cost. And then once we implement programming, then we start talking about cost savings and how long-term, not only is it the right thing to do by employees, but in actuality, you can bend the cost curve of the healthcare spend for an employer. So that's key, that's conversation. So I would suggest that you do have a look at the Surgeon General's framework. It is brilliant. There are some working tools within that site that are really great to have as medical wellness professionals. All right, number 2, this is the second rising healthcare issue in America. A lot of it is predicated upon the work from home model. Before the pandemic, 1 in 67 Americans worked from home. It is now 1 in 7 that work from home, although we see more return to work coming week over week. With that work from home model, we have individuals, and this is your consumer profile. These are your potential members who sit all day, who are isolated, who are lonely, who are sitting more than they ever have, because when we were all getting up and going to work, we were getting up and going to work, get in the car, drive to meetings. When I was in my director job at the 2 hospitals, I barely sat a minute at my desk. I was running around to client meetings and in and out, and now I sit a lot more. This is not health, right? It's the opposite of health. So with this sitting posture is a lot of musculoskeletal issue, neck pain, back pain, hip pain, metabolic issue. It's one of the worst things for those with cardiometabolic issue, right? So it's just exacerbating pre-existing conditions and creating new ones. So this is one we're going to also have to watch. So 1 in 2 Americans is experiencing pain. This is from a white paper that was released by Hinge Health. They did a webinar last week as well, and there was some updated data. But some of the interesting nuggets that I got out of there, 1 in 2 Americans experiencing pain. I certainly didn't think it was that many. And interestingly as well, 64% said they're not getting help despite understanding the factors of pain and knowing that pain day over day is creating depression when you can't do the things that you love to do. And it increases activity avoidance. So it's a double negative. You don't want to go and work out if you're in pain. You don't sleep well because you're in pain. You start to get anxious and fearful, and your tolerance to pain goes up. This is a perfect storm again of not so good health outcomes, right? And then the nervous system, if you are medicating and or ignoring pain, the nervous system basically becomes overactive and desensitized. And one of the things I took away from this particular learning and the white paper was that those with pain, the symptoms very closely mirror depression. I honestly can't say that I had thought about that before, but it makes sense. So our call to action, knowing that 1 in 7 Americans works from home with pain issues on the rise and increasing cost to employers, we are the ones who live in the prevention space, in the education space. So it's our job to offer posture health programs, mobility assessments, fit breaks, sleep programs, mindfulness training, and of course, to have the conversations with our members and clients to be connected with their PCP. This is how we differentiate ourselves in the industry from most commercial clubs, right? We will have these conversations where many who are working in the industry in other settings are not having these conversations. The other thing I'd like to share is this comes up for me as super important because when I was working at the hospital, we talked a lot about public health and the social determinants of health because we used the community health needs assessment with the board, the hospital board, and our C-suite and myself as director of wellness to create the partnerships within the county to determine, once we did our community health needs assessment, to determine what the public health needs of the county were and what programs we needed. Well, I was the director of wellness at the hospital, so I could make magic happen with my team to fill any need that came up, having pre-diabetes programs, stress management, weight loss, those kinds of things. Most hospital systems don't have those, so they need you to partner with them. So social determinants of health, something that will be very particular to the zip code you live in. Do investigate this if you want to see. You can Google this and find out what the Community Health Needs Assessment report was. It's going to be like 143 pages long, but you can dive into the health metrics, BMI, so forth and so on, activity rates, those kinds of things, the things that we bring solutions for. You can actually get the scorecard from the hospital because it's a public document, and you can approach someone at the hospital to say, you have programs that will help them achieve the roadmap that they create for the next 3 years trying to solve the county health problems. All right, so within this, things we're needing to be mindful of, and something that comes to light from my corporate wellness background is the concept of wellness privilege. And we don't want to be in that space. We want to be creating, I think we do, opportunity for all to be able to have us as their partner in their health journey, no matter where they are in the journey, right? So how we deal with the social determinants of health can make programmatic change to accommodate particular groups. So we need to customize appropriately. So if you're working with an employer, as an example, hourly employees, if it's a company that's mostly hourly employees, you'll need to have offerings that are less than 30 minutes because they'll only get 30 minutes on their lunch break if that's when you're going. If it's more of an on-demand offering, this is less of an issue. Racial differences to be mindful of. Employees are no longer affording copays. This recession and the financial hardship that is a direct result of the pandemic is real. So we need to be mindful of that. And prescribing specialized equipment, whatever space you're in, some folks may not be able to afford it. So just some things to have top of mind. And also understanding that in some counties, the one that I was in North Carolina, health literacy is very low. I used to write at 3rd grade level because my marketing director told me that that was what I needed to do. That the average consumer in the county would make sense of the content that we were putting out in our health and wellness programs that we sold. So just some things top of mind. So if you should be hoping to partner with employers, this is why it matters. So if you had an employer say, you know, we don't need a posture health program or a pain management program with some lectures around what it looks like, feels like, and how we can feel better. These are the waste in care factors rising spend issues for employers. So although the HR director or C-suite members maybe haven't quite nailed this, we know what this is. So I want you to have this in your toolbox. So pain management might be, I'm managing my pain by increased medicines. That's a spend on the health plan. It might mean more doctor's appointments. That's increased spend on the health plan. It might mean specialized care. That increases the spend on the health care plan. It could mean surgery if they're not well managed and eventually need some kind, let's say back surgery as an example. Those are incredibly expensive. All possibly avoidable if we would just get up out of our chair, right? So we have an opportunity to have great impact doing what we do. It's just framing it up as a customized solution for your partners, whoever you want to partner with. So there's increased costs with injections, radiology, surgery, et cetera. And nationwide in the employer wellness space, there's a huge underutilization of behavioral health services. And there's also a huge shortage of behavioral health providers, just because the demand has increased exponentially with the pandemic and the stress of all of that. So I think a call to action is to remove the barriers, make things easier for the employers. That's a huge portion of your population in your county is the working person that is still in the workforce. Take your services on site to employers, teach tech neck, mobility stretching, posture remediation, and stress management. All things we could do, charge monies for, create ancillary revenue streams for your operations. It's a win-win. And then the last trend, we've got a mental health crisis, MSK issue madly on the rise, and obesity. Of course, we all know this, given what we do. But CDC forecasts that by 2030, over 50% of Americans will have a BMI greater than 30. And just recently, Teladoc expanded its provider-based program to prediabetes and weight management as the demand surges for weight loss drugs. So the pharmacist I had on last week shared that telehealth laws were changing and that she fully expected by 2024, telehealth would not have permissions anymore to prescribe these weight loss medicines that we're all talking about without an in-person doctor's visit. So we'll see if that happens or not. But the shares of Teladoc with this news have gone up 11%. So it's an uphill battle and it's a big mountain to climb. Our call to action is to get busy, start offering lifestyle education programs, and to educate ourselves that our potential new member and existing member profile is not what it was 3 years ago. Overweight, out of shape, depressed, stressed, in pain. And I saw a term by Mel Robbins this morning called languishing, where you're just stuck. You're just so overwhelmed that there's no hope. That's concerning, right? So the summary of these trends, the consumer profile has changed, both our existing members, and we need to adapt to that, to meet people where they are. So America is suffering from economic anxiety, sick and tired, burned out, stressed, all of these things with pain that mirrors depression. How do we accommodate this profile, right? So we need to be innovators, create new programs that maybe we've never considered, new fitness classes on our schedules, new personal training protocols, level up, get advanced, whatever it is that you need. If you don't have it, it's in your toolbox, reach in, pull it out, and start creating some programs. The ROI on it is much stronger than one-to-one anyways, right? So I'm advocating that we take a step back, we take the data in, and we realize that things are a little different now. We also need to cross-correlate the data that suggests who our new members are and the current members, what this new profile might look like, with a needs assessment of our current members. Let them tell you how they feel and what they're looking for. Do we need Friday night yoga? What do we need? What do we need to feel better? Add lifestyle education programs to your offering to create community, to reduce isolation. Whether you bring them across the threshold of your facility or you zoom into their living room, get busy. These programs are the glue for long-term success. Once you create community, they're going to want to stay with you. And you will have them as members at some point if they're within the proximity to be able to resource you that way. Customized programs for consumer needs. One that's huge. I am teaching currently at a wellness center aligned with a golf and country club. I cannot tell you the number of injuries from pickleball. They're in my fitness classes and they are wiping out on the pickleball court because they have no lateral mobility. They do not have any speed left in their bodies. And so any dynamic with rotation, they're throwing their back out. All these things are, to me, opportunity to build your business model and programmatically be in the prevention space so you can get ready to play pickleball so you don't get injured. So let's work on rotation, getting out of the sagittal plane, these kinds of things. Posture health, any program that has de-stress, meditation, recovery, breath work, yoga, time to customize, add in, and take care of folks with their health profile as we see it now. Something very cool that has gone on in the industry, and we can do it too. This is brilliant. So the creators of SoulCycle, 2 women, created something called Peoplehood. It's not about cycling. It's just join our social club. Now, I don't know how much it costs or any of that, but the concept to me is profound and it's brilliant. Just come into the club. We're just going to talk. This is what's going on. Obviously, over time, they're going to have a membership, probably, but that's not how they're leading. They're adding in to get people out of their homes to come together and just be with one another, because isolation is real in America right now. So our call to action is to service the sick and tired. And if it's not us, who is it? And I can share from experience. I was at 4 fitness conventions last year. I just got home from another one. The average, and forgive me for this, but folks that I'm encountering and in my master classes, they're not thinking about wellness. They're thinking about fitness. And to me, that's a different equation. I want us to lean into everything wellness because we have the ability to do it. We're thinking more about more than just the exercise equation to being healthy. We're thinking about a holistic approach, right? So let's just for fun, if we look at the lifespan, we go to school. Do we learn anything about good health, how to eat well, sleep well, any of those things going through elementary school, high school? Go to college or university. If you're not studying in our discipline, our area, what are you getting there? Then we go to work and we grind away for 40 to 50 years of our career. How many companies have quality workplace well-being programs where you can do it at work, where you spend most of your time? Maybe we're going to church. Are we getting anything there? Wherever your social outlet is, what are you getting there? When you go to the gym and fitness center, are you getting lifestyle education? What are you getting with your membership? When you go to the doctors, are they taking 45 minutes with you and teaching you about healthy lifestyle choices? Generally, no, because they only have 15 minutes with you. And then we retire. Is it too late at that point? Have we completely missed this journey? We want to grow old from retirement to when we pass and just running to doctor's appointments and taking medicines and missing out on all the life events because our knees hurt or our back hurts, right? So we have a lot of work to do, but we are the right folks to lead the way to do the work. So if we sum it up, physicians don't really have time and they're not particularly trained in it unless they're in the lifestyle medicine space. We now have a shortage of nurses in America. We now have a shortage of behavioral health experts. You can wait 3 to 6 months to see a counselor, depending on the state you're in. And we have more commercial fitness clubs than we do medical. So there's less of our demeanor and ability to meet the need nationwide. So we have to lead the way. And we have a shortage of fit pros in clubs across America. So if you go to the doctor, who are they referring their patients to get what it is that we can offer programmatically? I'm talking about much larger than a gym membership, right? I'm leaning into health and wellness programs that create community. So just some things to stretch a little bit. What if fitness clubs used wellness as a growth curve for their fit pros? So you join a club as a fitness instructor and you can grow and eventually be a wellness professional. What if the industry started thinking about that? Because as a fit pro, we know a lot. So can we teach a basic 8-week program with basics of sleep health, hydration, exercise 101, maybe setting up your own home gym, de-stress, all these basic things. When I was working in 21 for an insurance company, I created all the wellness programs for the book of business for the insurance company. 1 month long programs. I created one called Reset Your Health. We charged, whether we had outcomes or not, I'm ashamed to say it, but that's why I left, $3.75 per member per month for my very simple 1 month calendar called Reset Your Health. A leader in the industry, Sonic Boom, at the time was charging $5 per member per month. Just to give you some perspective, there is some money here for us to be able to bring into our service lines. Commercial fitness clubs, what if they knew that we could partner with them and help them learn how to have wellness programs and or refer their members who they really maybe don't want to get into this space, but need their members to go to a personal trainer that has pre and post tab experience, or the weight loss program in your center that they're not ever going to do in theirs. Those are partnerships that can be had. In my career, I needed a therapy pool in my medical wellness center. I didn't have one. We were never going to have one. But I ran weight loss programs and all kinds of medical wellness programs. I needed for some of my patients in my programs to be able to go to a therapy pool. So I partnered with the local college and we made an arrangement. It was a win-win. Right? So this can be done. Solopreneurs. What about the folks that left the fitness industry, went out to market to create their own business and doing maybe really well and have a whole bunch of personal training clients that really need aquatic therapy? Could you partner with them and let them have access to the pool and create a win-win? And maybe by doing that, get some of your fit pros back? Just a thought. I'm just thinking out of the box. And what if employers knew that we could meet their needs, come on site and make it easy for them to have hybrid workplace wellness programs? Because that's what we do. No better place to do than at work, because we're 8 hours a day, if not more, with the company, right? All right, so summing it up, some of the gaps, we can see where there's not opportunity for referrals. If 80% of health outcomes are driven by non-clinical factors, we have to teach, right? We need to hit the gas right now. We need to get on the prevention space, pre-diabetics not becoming diabetics. We see the telehealth space is getting into it. Prescription drugs are getting into it. Of course they are, because they see what's happening to the health of America. We need to step it up, right? We know exercise is medicine. 10 movements a day, minutes of movement a day is better than 0. Right? We know this, so we've got to really spread. So the power of prevention, and I really challenge us to start changing the language, speak to wellness, not fitness, approach the consumer as a holistic being, all of the elements. It's not just exercise. That is a component, and it's a huge component. But if everyone's burned out, stressed out, maybe their health journey is starting with a stress less program with you at your club. Then they join the club, maybe. All right. Another looming trend, just to show you the gaps in care. Becker's Healthcare just released a white paper this week that health plans are going to start working in post-discharge coaching, behavioral health coaching, ongoing coaching, and the future of cancer, and cardiometabolic coaching with food delivery services. I think all medical wellness centers need a health coach. Sell that service to employers. That's huge. Want group programmatic stuff? You can do really well with group, make decent money with it. Invariably, those individuals in the group will then start to want individual services to talk about their meds and their problems and their things. It's just a natural, organic offering of health and wellness on the journey. Fit pros are trained to provide exercise education, so we lean into more of the movement piece of the equation, but we can definitely do more than that. And teaching fit pros and elevating the industry that the connecting back to the PCP is critical. We understand that, but we need to teach it. It's not necessarily the norm. In medical wellness, it is. So we are the wellness providers, right? And creating that continuum of care. Again, I see it all. I see it as a pain point for employers, for individuals. I see it a pain point for healthcare systems because I worked for one, and us in the fitness industry trying to get business back to and fast forward to thriving beyond where we were 3 years ago. So we need to remove the barriers and make things easier. Here is the link. As far as strategies, I referenced the community health needs assessment. Here's the link. So you can check in your county and then make some connections. Basically, it roadmaps the top health risk factors, and the not-for-profit hospitals are required to produce an action plan and find the right partners to meet the goals that are board approved by the hospital. So that's huge. All right, so here are some things that I've done super quick. Strategies for medical wellness professionals to partner with commercial fitness clubs. I do think there's huge opportunity. When I was at South Florida YMCA as the senior vice president, we partnered with Cleveland Clinic. We built out a physical therapy clinic of 1,200 square feet at the front entrance of the Weston YMCA, massive win-win. And we created a model that was community wellness. We got more members, they got more patients, perfect win. One of the things you'll see in the industry right now is the concept of a club within a club. So if you have a specialty that a commercial fitness club doesn't have and or doesn't care to add or cannot afford to, partner, right? Definitely partnering with your healthcare systems, partnering for the access of pools, that can go either way. Cardiac rehab in a commercial club. Do you have a thriving cardiac rehab program? Are you running out of square footage to run it? Partner with a commercial club and just do a rev share of some sort. And maybe your weight loss program is booming and you want to have a broader audience. Maybe you take it into a different audience. Go to a church. That could also be part of it, right? So for employers, everything I'm reading, Benefit News and all the papers, basically employers are looking for quality care at appropriate time. So we have to be available when they need us. We are the quality medical wellness, the continuum of care, that's us. And they want to improve mental health and well-being of their plan members in partnership with the employers. That's us, right? Also, their strategies are identified to be able to offer programs to improve specific health conditions. We have diabetes programs. We have pre-hypertension programs. We can go to employers. The specialty drugs, we may or may not get into that. And then they want to expand their virtual care offerings beyond telehealth. We can do hybrid. We can do Zoom. So we have a lot of opportunity. I've also learned from Blue Cross Blue Shield and a couple of other friends working in the insurance space. They are adding their health promotion consultants back to payroll, but they're not doing one per county. They're doing one per region. They are looking for partners to do webinars because these health promotion consultants are coordinators. They don't lecture. So that might be opportunity for you as well to be the local talent to go and do the diabetes talk or the nutrition talk for their employers. That's coming back online. And then I think one of the best things you can do globally to position yourself in the market, This was very successful for me at the North Carolina hospital. It seeded business faster than I could go, was to create a wellness advisory council. And it could have the niche market of employer wellness or just general. And then invite your partners, invite HR directors, a CEO, several physicians, invite someone from the local Blue Cross Blue Shield group, a local broker, so forth and so on. Host meetings every month, share best practices, trends, and shared experiences and solutions. Basically, now you're positioning yourself as the expert with the solutions to their problems. And that's huge. You're building community in your market. So to summarize, I'm wrapping up. Docs generally don't have time. We have a shortage of providers, nurses, mental health. Fit pros elevating to wellness pros. So we're talking about more than movement, because some of our consumers, they're not going to start with exercise. They need to start with mindfulness, perhaps. Maybe it's something different, right? And we can do it all. We need educators and programs, advocate for continuum of care, annual well visits, having a PCP, all of these things, creating referral networks, and we have to lead by example. That's huge. So the call to action, and I bet you have some things you would love to add to the list, and I'd love to hear them. This is the low-hanging fruit. Start by making a list of members in your club or in your circle of influence who are business owners. Talk to them. Find out what their well-being at work needs are for their employees. You could start right there with people in your club that know and love you and trust you because they're members of your facility. Make a list of programs and services that you could go to market with today, because then you're ready to have the conversation with them, right? Make a list of hospitals and clinics within a 5 to 10 mile radius of you, your facility, and find out who you can talk to partner. Who are the docs referring their patients to? And step down that needs to be us. Conduct a member needs assessment. You've got to stay connected with your people. If you haven't the time for that step, just talk a lot, ask questions, and then get ready to offer new innovative classes and programs. This is the fun stuff. I know it's build the plane and fly it at the same time. I understand. That's exactly how I worked as a director. Keep everything going and create new things too, but it's a necessary step. All right. So thank you very much for attending. I do have my information, and I have permissions to let you know that I have a special discount for MFA members. If you'd like to do either of my master classes starting second week of May, you can go to my website, type in MFA50, and you'll get $50 off either of the classes. All right, Marianne.
Awesome. Well done. Thank you.
Thank you.
So we do have some questions and comments coming through. Maureen wants to know, can you share the standard definition, if there is one, of the difference between wellness and well-being?
Yes, so the terminology has changed depending on the organization that you look at. National Wellness Institute, Global Wellness Institute, WellCOA, American Journal of Health Promotion. Those are just a few of the sources that I used to use. Wellness, it's going to have dimensions of wellness. Well-being leans more into having all those elements of wellness: physical, mental, spiritual, etc. The well-being difference is sprinkled over top of that is the sense of having a purpose and joy in your life every day. That's the difference. So it's a little bit of an emotional overlay of enjoying your life, still having these 6 dimensions of wellness.
Awesome. So just as I'm talking here too, if anybody has any questions, go ahead and throw it in the chat section. That seems to be where they're all coming through. Terry agreed with you. She said the pickleball injuries that she is seeing are insane.
Yeah.
And that,
Yes.
I had no idea. I'm not a pickleball player. But she said just, trying to move backwards, bad sprained ankles. They're not prepared with proper stretching skills. And that's an area that I've been seeing cropping up are these stretching facilities, stretching gyms.
Yes.
It's a thing. Let's see. Terry had asked to share the presentation with the director at her club, just to show what's going on. We got a thank you. And yeah, awesome. Oop, let's see. Bob says, bravo, Debbie, and thanks to MFA.
Hey, Bob.
So that is awesome. Just make sure I'm not missing anything. While we're waiting to see if anything more, and Margaret says, great presentation. I will thank you so much, Debbie, for sharing your knowledge with us today. Always a good time. All attendees will receive an email right after this with a speaker evaluation for today's webinar, and it includes a spot to indicate which CEC you'd like to receive. So please be sure to complete the survey. Also, if you don't need CECs, we would still love to have you fill out the survey. Your feedback helps us in planning educational webinars, and it helps our speakers with their presentation skills. Our next webinar coming up will be on Wednesday, May 3rd, entitled Power Training Research-Based Insights for Training Older Adults. And that will be with Dr. Joseph Signorelli. He is a professor and a researcher at the University of Miami. He's also the author of the book, Bending the Aging Curve. I'm looking forward to hearing that one. But we've got plenty more webinars coming up. You can find them on the MFA website at medicalfitness.org. Oh, I was just about to read your comment. I was like, oh, and Debbie says, but Debbie says, thank you so much to everyone. Appreciate your taking the time today. Thank you again to Debbie for sharing her knowledge. And if you want to check out Debbie's master classes, visit debbiebellinger.com. Jennifer says, great presentation. Thank you from Jeanette. So awesome. And we are right about on schedule.
Woo!
So, woo! So thank you, everyone.
Thanks, Marianne. I appreciate you. Thanks, everyone.